Blood pressure assessment. To begin, I will briefly go over the instruments needed when recording resting blood pressure. You will need a blood pressure cuff, a manometer, and a stethoscope. It is important to note that patients should be seated quietly for at least 5 minutes and refrain from smoking cigarettes or ingesting caffeine at least 30 minutes before measurement. For accuracy, the patient should be seated with their feet flat on the floor, back straight, and palms facing up to expose the brachial artery. To begin, identify the artery mark on the blood pressure cuff. Align the artery mark with the brachial artery and wrap the cuff firmly around the upper arm of the patient at the heart level. The appropriate cuff size must be used to ensure accurate measurement. The bladder within the cuff should encircle at least 80% of the upper arm. Many adults may require a large adult cuff. Ensure that the prongs of the stethoscope are facing outward in order to hear the sounds. To double check, gently tap the chest piece of the stethoscope. Good. Gently palpate the patient's arm to locate the brachial artery. Place the stethoscope chest piece below the antecubital space flat over the brachial artery, and quickly inflate the cuff pressure to 200 millimeters of mercury. Once the cuff pressure reaches 200 millimeters of mercury, slowly release the pressure at a rate equal to 2 to 5 millimeters of mercury. Next, listen for carotid cough sounds, which are separated into 5 different phases. The first phase, being the systolic blood pressure reading, is the initial sound or the onset of sound. The fifth phase is the complete disappearance of sound, and this is the diastolic pressure reading. The blood pressure reading for this client was 110 over 80 millimeters of mercury, which is considered normal. The norms presented in the following table for resting blood pressure are for those older than 18 years old. To use these norms, individuals should not be taking any hypertensive medications and should not be acutely ill during the measurement. When systolic blood pressure and diastolic blood pressure fall into two different classifications, the higher classification should be selected. This classification is based on 2 or more readings taken at each of 2 or more visits after an initial blood pressure screening. Generally, these norms are revisited periodically. It is generally recommended that all people older than 30 years old have their blood pressure checked annually.